Okay, we are getting everybody back on. Thank you, Facebook, also for coming back. Sorry, guys. Hopefully, I don't hear any static just yet, so hopefully we will do better. I'm getting Dr. Patrick back on here. Okay, how are we doing? It's clear now. Yay, it worked. Thanks, Reinzer. It is a whole lot better. Awesome. Thank you. Very good. All right. So we were at you telling us about yourself, Dr. Patrick.
Uh-huh. Um, there is quite a bit. I started out, way back when I was in high school. I figured that I wanted to do something in the medical field. Not sure which one I wanted to do, whether it was human medicine or veterinary medicine. It was only when I was probably in my third year at Case where I sort of finally decided that this is what I wanted to do. Back then, Dr. Logan was a vet at Case, and I used to follow him quite a bit, and learned quite a few things. And I thought maybe I wanted to be like him, and so I started applying for vet school blindly without knowing how I was going to pay for it or all of that. I was accepted to. There was a vet school in Grenada. I was accepted to that one, but the school fees were so expensive that I decided to wait. And then one day I was in the library doing a lot of research, and I saw this Galena article about scholarship for veterinary education in Russia, and I applied for that one, and then the rest is history. So from back then, that was, I think it was 2002, and then I started my veterinary studies in 2003, and I did 1 year of language because I studied in Russia. I did 1 year of language and 5 years of veterinary education. Came back to Jamaica in 2009. I became board certified. I stayed here for a year, and then I left. I went to the UK. I did postgraduate studies in Liverpool. I'm wearing my Liverpool shirt, as you can see.
Okay.
Um, yes, I did postgraduate studies in Liverpool. I came back in 2014. I worked with small animals for a while before I joined CB in 2015, and I've been with the company for 5 years now.
Okay. All right. Very cool. So you speak fluent Russian?
I speak fluent Russian, yes, and I still do. And I also teach Russian at UWI part-time, so I still carry on my Russian side
Oh,
of my career.
very. I have a.
And I'm a licensed translator, so that's also something I did while I was back in Russia, because I decided that if I was going to take this thing further, it makes sense to have some form of credential in it.
That's nice. Very nice. So when I need something translated in Russian, I'll know where to come. I
Please.
but I never thought about Russian, so that's something I might need to add to my list. All right, very cool. So tell us about your role and function at the CB group, and tell us how the group connect to Nutrimix. Give us all that good background there.
Well, CB is a group of companies. Nutrimix is just one of those companies in the group. So I happen to work at Nutrimix. The parent company is CB. My roles and functions at CB, I provide veterinary services to commercial farmers both in Jamaica and the wider Caribbean, because we do export to about 12 different countries. So we provide that sort of veterinary assistance, which means I go around in Jamaica in the days. We do quite a bit of stuff. We do seminars quite a bit, so there's a lot of training. We do, assisted reproductive breeding. You've seen us all over the country doing that. We help quite a bit of farmers if they have problems, and we assist if they just need general management. Anything that they need, we go and assist them. Some days we just go out and we ensure that things are good with their farms, and so whatever assistance they need from us, then that's where we come in.
Okay. And that's one of the things we've talked about several times on the IG Live is that I don't know if there's any other country where vet services, for the most part, you can get a for free for all intents and purposes. I mean,
Well, it's not free because somebody. I wouldn't say it's totally free because somebody has to pay for it. Veterinary care is very expensive.
Yeah.
especially in first world countries. It's quite expensive. It's no different down here. When I work in small animal practice, it was quite expensive, depending on where you go. So I wouldn't say it is free because Nutrimix is paying for the services that we provide to you.
Yeah. So it's free, free to the farmer, but somebody's paying for it for the most part.
Well, yeah, it's and it's not totally free for the farm to the farmers. We ask them to pay us back in supporting us. So if they could do that, then we consider that as them paying for their services.
All right. That's yeah. Awesome. Thank you very much. Okay, so I know you cover a wide spectrum of animals that you have expertise in. So give us an idea of all the animals that you cover in.
I do quite a bit of poultry, so broiler birds, layer birds, we do that quite extensively. I do quite a bit of pigs, goat and sheep. Cattle is probably one of my favorite. You might not know that. At Nutrimix, I don't do quite a bit of horses, but before I joined the company, I had a little short stint at Caymanas Park, so I do some amount of horses. There was once a product that I usually make for the guys at Caymanas Park. The top trainers, they usually buy it because it was quite expensive. I think it's something that we call platelet-rich plasma. I'm probably the only vet in Jamaica who has done that. I started in 2014. I ended that in 2015 before I joined CB. Kind of advanced technology in trying to bring back the horses into racing, in a shorter time, maybe half the time that they were out if they were just using conventional treatment. So pretty much and then turkeys, we also do turkeys when they're available. So
That's pretty cool. So you basically cover the gamut. So whatever animal we have, if there's something wrong with it, we can call Dr. Patrick. All right.
yeah, and I think I'm very competent in small animals because I did almost 4 years of small animal practice in Moscow. I came back, I did maybe just under a year of small animal practice, so I consider myself also very competent in small animal practice.
All right. Very cool. Okay. So let's jump into the heart of the matter of our topics for today. So our topic for today is AI, artificial insemination, and animal health. So let's start with AI, artificial insemination. So we have some people, like again, we have people from all walks of life. So we want to make sure that everybody's on the same page. So let's start at the very beginning. What is AI? How the process works, how long does it take? How do we get assistance from the company when we work with them? Just give us a good idea, rundown of how the whole process works.
Well, AI is basically, getting rid of the males on your farm, whether it be goat, sheep, pigs, cows, whatever, and taking the semen. You could use fresh semen, you could use frozen semen, and putting that into the reproductive tract. So you're assisting. We call those assisted reproductive technologies. So you're basically, removing the males, and we put in the semen in the reproductive tract of the animal. Is AI for everybody? There's a lot of people who say they want to expand their herd, they want to expand, the amount of animals they have on the farm. But is AI the right thing for everybody? I say to farmers, if you're starting out and you want to expand the amount of animals that you have, AI is probably not what you need to do. That's probably not what you need to be doing. AI is for people who want to improve, a certain, genetics on their farm. If you want more superior breeds to actually carry out more superior, breeding, then maybe AI is the way to go. But if you're trying to improve and get more animals, if you're trying to move from maybe 10 to 50 animals, maybe AI is not the most convenient thing for you to do. So we want people to know that it is not for everybody. It's inexpensive. I would say it's inexpensive because we've taken away quite a bit of the cost. If you were doing this maybe in the States or in Europe, you'd have to be paying a large chunk of money for veterinary services. Whereas down here, you're only paying for the semen, you're only paying for the drugs that we're using. So the cost is substantially reduced. And so that is one big advantage that people generally don't talk about. It's quite easy, basically. If it's something that you really think that you need, what we do, we come out and we have a look at your farm. We ensure that your animals are in tip-top shape because we just don't breed any animals. You can't just take any animal and say we want to do AI on this one. AI is for the best animals that you have. So we always say to farmers, look for the best ones that you have on your farm, those that you think will give you the best results. You feed those, the best, and then we put semen on those, and it be pigs or cows or goats, sheep, doesn't matter. We also do AI in dogs, so that's, and it's the same procedure. Farmers could just look us up, call us. We make a visit. We come and look at your animals. Generally, we want to either ultrasound if we're doing sheep and goats, or palpate. We also ultrasound for cows to ensure that the animals are not pregnant, because it would be catastrophic if we try to do AI on animals that are already pregnant. So we ensure that your animals are open, because we also use drugs in the AI process that if your animals are pregnant and we inject them with those drugs, then they're going to abort immediately. So we come and we do our checks. We ensure that the animals are looking good. We want them to be on the best plane of nutrition. And once we're satisfied with that, then we go ahead with our AI protocols. There are many of them, but we choose the best ones for the type of animals that you have. If we're talking about goat and sheep, there are different protocols. We use the best one that give us the best conception rates. And there are publishable rates out there that people can look at. And I'm sure later on in the conversation, we're going to get to, conception rates and all that. So we will discuss that later. If we're talking about cows, then it depends on, if we're talking about Bos taurus, Bos indicus, then they're different, or if we're talking about heifers or, cows that have been bred before, then there are different protocols that we use. So your knowledge really has to be very extensive, because not every protocol will fit every animal. So we really need to know what we're doing before we actually, get along with that.
Okay. Now, we didn't mention, we don't recommend doing AI if it's a virgin animal?
Yes.
You want to talk about that a little bit?
Yes, virgin. So with goats and sheep, they are what we call cervical rings. They are not aligned in a straight line, so you can pass the AI gun right through them. It's very difficult. For the sake and welfare of the animal, we recommend that we don't do it in those virgin animals, because it's extremely difficult. And the AI gun that we are using, it can cause a little bit of trauma, and so we always recommend that we want animals to have at least 1 litter first, raise them, wean them, and then we can do AI on those animals. People have done it. It's as I said, it's difficult. It's not good for the animals, and for the welfare of the animals, it's best if we do it on animals who have had babies already.
Okay. So you did say it's not for everybody, but is there farm or limit? If I have one goat and I want one goat, so I do it, or what parameters do you guys look at when you go to a farm to determine whether this is a good candidate for AI or not?
So if you just have one animal, of course, we wouldn't recommend a farmer who has just one animal to call us to do AI somewhere. If you're close by, fine. But if you're afar off and it's going to cost us more to actually drive to see you than the cost of doing the AI, then it's not really economical for the company. But let's say you have one animal and you want to do AI on this particular animal. What are we looking for? We want to ensure that your animal is not sick. So we want the animal to be healthy. And when we say healthy, we mean free of all diseases and whatever conditions. The animal would have been bred at least once already if we're talking about goats and sheep. We want you to at least, would have been feeding this animal on a high plane of nutrition at least for a few weeks before, the AI date during the breeding season also. We also recommend that that animal would have been on some form of, free choice minerals, because there's one thing inside there that we always recommend. For example, vitamin E, selenium, which is very good for reproduction. We want your animals to actually be on that. And once the animal is not pregnant, the body condition is good, run about 3 out of a score of 1 to 5, then maybe that animal will be the right candidate for AI.
Okay. All right. When you do go through the AI process, what kind of things are you looking at the farmer's facility to make sure that we can basically manage the process and get the whole process done? Because you've done it here for us. So is there anything particular, more space, space to wash your hands, that kind of stuff? How do we need to prep the farm to get ready for this process?
Yeah, so we want your animals to be, those animals would have been isolated, long ago. Animal is ready. Let's just say all the animals are ready, and we come in, we need a nice little area. We want to put our you know, a little facility where we're going to keep the animals, you know, away from too much light, because you don't, you know, at least looking into a dark area. Yes, we need water because we need to wash up our instrument. You know, we're going inside the animal, so we want to have sterile, you know, equipment to actually put in the animal. So we're going to need water to wash our hands, to wash equipment, and we need soap. You know, we need disinfectant. Preferably if we do not have too much flies flying around, because, you know, they transmit diseases, and we don't want that. As I said, we're going inside the animal. And once we have helped all the animals, then, you know, that's pretty much what we need.
Okay.
Not
All right.
much.
Not much. All right. That's good because, you know, most locations, you know, as long as you have the basics, basically, then you.
And of course, that was just for sheep and goats. If we're talking about cows, then you're definitely going to need something called a race where the cows can actually stand in, and so that is very important. If we're talking about beef cows, then those are a little bit more dangerous than dairy cows. So we're definitely going to need a race for those, something sturdy that they can stand in, and it's also for our protection.
All right. Very good. So, what's the average cost of getting AI done, and how do we go about contacting you guys to say, hey, we want this done?
Well, the cost for the AI is simply the cost of the semen, and that has been out there, which is $8,000 for the ones that we have, plus the cost of the drugs and equipment that we use, and combined we use 2 different drugs, plus we use another device, and those costs altogether is about $2,500. So if you're doing one animal, it's about $10,500, which is quite minimal because the veterinary fee is scrubbed from that. If that was added, it would have been far more substantial.
Mhm. Okay. All right. So basically, as long as you have the money set aside, it's basically for anybody who wants to do it. So,
Yeah, and you can contact us by, you know, via any means. We are out there in the public. You can call us. You know, farmers usually have our numbers. So once you call us, we will find you, and then we'll take it from there.
all right. And you do have semen in stock right now?
We have semen in stock, but we are awaiting a new stock, so that is on the way presently.
And so you'll set, how do we know what type of semen you have in stock and what are the options? Do you want just meat cow or I said cow, I'm sorry. But that's for cows too. But
Yes, yes.
milk, you know, can we select from what you have?
You can select. We do have catalogs. You know, you can request that. We send it to you, and you know, it's what you want that we'll give you. So we don't impose anything on anybody. If you say, if we have 3 bucks and you want this one, or we have 3 bulls and you want whichever, you tell us what you need, and we give you what you need. So we don't tell you what is best for you. It's what you want that we'll give you.
All right. And we'll be able to see like the line of the where it's coming from and get kind of a history of what so
Yes, and everything is online. We can give you the name of the box. We can give you the name of the bulls. You can Google them and you see exactly what it looks like and you see all the information. We also have catalogs for, if we're talking about cows, we have those catalogs where you can look at the daughters. You can look at, you know, all the information going way back. So there's quite a bit of information, and all of those are available if you need them.
all right, very good. Because we want to know what we're getting into. Don't want to just be having this. All right, very good. So I'm gonna move over to animal health. We'll probably come back to AI, go through the discussion, but let's talk a little bit about animal health first. So, based on your experience going around the country and been doing this for years, what would you say, and we asked Dr. Young this, I'm going to give you a chance to answer this too. What would you say are the top 5 most common animal health issues that you encounter as you visit farms in Jamaica?
And we're talking about all animals right now, yes?
Yeah, we can start
Not
with
just
all,
goats.
narrow it to goat. How about that? Start with all and then we'll narrow it to goats and sheep.
So you talked about, you know, what are the major conditions that we're seeing out there. Well, I think number one, we have to just look at most of what we're seeing is maybe 90% of the time they're just linked to management. Most of the conditions, they're not really diseases, but management issues, where a farmer may not understand what they're doing or what they're getting into, and then, you know, they do something incorrectly and they run into problems. Jamaica is a very hot country, and we don't have those winter and whatever other seasons that you find in other places. So for 12 months at a time, you know, you can run into problems like heat stress. We see that a lot, not just in chickens, but we see that in other animals, in dairy cows, and we see that in goats. once you have that problem, then everything goes south. Chickens start to die, they don't strive. Your cows, they're not producing as much milk. In the cooler parts of the year, where a cow would be producing, for example, 10 liters of milk on a daily basis, once we start having heat stress problem, then that could easily be cut in half. And so that is it's a major problem. With goats and sheep, with heat stress problem, we see also the same problem. But another major factor that we encounter with that is reproduction tends to be affected once you start breeding animals when the time gets too hot. Then conception rates start to go down, and then that's also a major problem. So we need to ensure that we focus on that a lot, and it's one of the things that we're seeing out there right across Jamaica. The other thing that we're seeing also.
1 second. How do you minimize heat stress? How do you manage that?
So, for different animals, what we say to farmers is to ensure that if you're doing chickens, to ensure that you have the right amount of chickens inside there. If you're doing cows, to ensure that you have adequate shade. You could put up a shade cloth. You could do small misters, because once you put big industrial fans to get the hair moving. Same thing for goats. Same thing for chicken. If you don't have any hair moving, and you have them all out in the sun, the water is hot, or not enough water, then that's where we have a problem. So there are just simple things that farmers need to do. Sometimes you really don't need to spend a lot of money to manage these problems. So it's just the know-how that they need, and that's one of the things that we do when we go around the country. We start to advise farmers on how to minimize these problems.
Very good. All right, so that was number 1. All right.
So number 2 is when we talk about small ruminants, large ruminants, we do see quite a bit of parasite problems, and farmers are deworming. They're deworming quite a bit, but we're still seeing problems with parasites. It was recently I was with a farmer, and we always say to farmers, if you're doing a deworming protocol, you need to know what you're deworming against, what you need to use, and you basically need to have a basic idea of the whole cycle of the worm. Some of these worms may have life cycle up to about 8 weeks, but you have farmers deworming like every month, which is every 4 weeks. We've seen farmers who are mixing like 3 different dewormers in one, and trying to administer to animals because of the thought of giving more medication to get rid of all the worm problems. Deworming animals who do not need to be dewormed, and then once you create that resistant problem, and then you have no more medication that can combat that, then what you find is that you for the long term, you're going to be having worm challenges that you really can't fix. So that is probably one of the biggest things that we're seeing out there. We're encouraging people to deworm animals if they need to be dewormed. You do not need to deworm your animals every single month, or every 3 months, for example. I know if you read some textbooks, or if you look online, they'll tell you that you need to deworm every 2 months or every 3 months, but you do not have to do that, because there are farmers in Jamaica who do not administer deworm any at all. So those are some of the challenges that we're finding. Another one is, we always say if you're using medication, it should be judicious. You should be able to use medication only when it's necessary, but we find that farmers are using medications simply because it is available, and simply because somebody sell it to them. If you look at chickens, for example, every farmer wants to buy their baby birds at day 1, and they want to go home with some form of medication, antibiotics or something. And we find that to be a challenge. And most of these medications that we're using, they're doing more harm than good. For example, if you take baby birds 1 day whole and you throw medication at them, there's a lot of stuff that you do. First, they have these microflora inside the gut. These bacteria will get rid of them, and these microflora enables the bird gastrointestinal tract to actually work properly. So you start killing them off from day 1, and these birds don't thrive very well. There are certain antibiotics on the market. What they do very effectively is that they bind to certain vitamins, and once they bind to the vitamins, it makes these vitamins unavailable to animals. And if you look at chickens, and it's not just chickens, it happens with other animals. Once these antibiotics bind to like the B vitamins, and B vitamins are very important for the working of the nerves and brain. It takes away the B vitamins, then you find that your animals start to get crippled. And a lot of people complain that animals are crippled, chickens are dying. And when you look at it, it's the same medication that they feed them too early, because their body reserve is not really high in these vitamins. And so, it's something that they need to to pay close attention to. So as we go around, we start to advise people that feeding antibiotics sometimes is doing more harm than good, and it's the same for all species of animals. So that's probably one of the biggest ones. Number four, I don't know. It's made, those three probably cover quite a wide range. Let me see if I could come up with something else. So there are some management issues that farmers are that they're practicing on their farm today. There's so many people doing stuff because they heard it from the guy down the road that I've been doing this for 10 years. I've been doing this for quite a number of years, and I drive up on farms and people look at me and say, well, you don't look older than my son. I've been doing this for 30 years. Who are you to come and tell me this? So there's a school of thought that the longer you're doing this, the more you know it. And we have a lot of challenges with management. We talk to people about changing stuff. People don't like to change. And so you find that they keep going downhill, and if they support you and they buy feed from you and the animals are not doing well, the first thing that they tell you is that maybe it's your feed that is causing it. And if you tell them something else, they say you're protecting the company. So I find that that's one of the challenges that I have out there today, that people are feeling that when you come and you give your technical advice, that you're trying to protect the company, you're not trying to actually help them. So that's probably one of the biggest challenges I have going out there today.
So we had a farm meeting. That's one of the things that we talked about, is that everybody knows everything. They've been doing this thing for years, the same way for years, like that, but that might not be the best way to do things. So we need to come up and do our own research and do our own homework to figure out the best way to manage a process. It's not necessarily what your grandfather, but we need to figure out. So that's a big challenge, but that might work for forever.
Yeah, you're breaking up again. I'm not sure if you're hearing.
Okay. On my end, you're great. So I'm not sure.
Okay.
Static. So
Well, as long as the guys can hear me, then that's fine. Because I'm just sometimes when you talk, I'm getting a breakup sound.
Breakup. I'm not sure. I'm fine. I hear you fine. I'm not sure what's
Okay,
going on.
good. Very good. Very good.
Probably our fancy internet out on the farm. You don't have a lot of choices out here, so you just do the best you can. So that's what's the problem. So did we go 5? I thought that was 4. Did we find the 5th one? No.
I think we went to 4. I think those are probably 4 of the biggest issues that we find, and it covers a wide range of species, animal species.
All right, so we'll move on then. So what would you recommend as the top 5 medicines that every farmer should try to have on hand?
It depends on what species you're doing. If you're doing, since this is iGoat and we're talking about goats and sheep quite a bit, if you're doing goats, I would strongly recommend that you at least have some form of deworm on your farm, because there might be a time when you need that. I'm a strong believer that if you're going to be buying prescription medication, that you actually treat them properly, because you can't just stick an animal with medication here and there without reasonable cause. But I would strongly recommend at least some amount of long-acting antibiotics to be kept on your farm, some amount of anti-inflammatory drugs. You're going to need some amount of vitamins, because that helps quite a lot, and iron. So those are probably 5 top things I would recommend that you keep. Anything else that you will need, then I think you can get that in due course.
Okay, very good. So I know Farmer Khalil put a note in here, and we also, you mentioned today that you guys had a discussion about broomweed.
Mm-hmm.
That is, first of all, right? And so tell us about eating broomweed, or what happens when goats eat broomweed, and what are the symptoms, and how do we treat it?
So broomweed is quite widespread. You see it all over the place. I think, people who don't know what broomweed is, that's what my grandmother usually used to sweep the yard. So it's all over the place. You see it in pastures growing up. Goats tend to stay away from it. If there's limited amount of forage, then they will eat it. The problem with broomweed is that and it can be cumulative, just like other poisonous plants. So the longer you eat it, it can accumulate and it can affect you in the long run. What it does basically is it affects mainly the central nervous system, so the brain, spinal cord mostly. And once that is, there are products inside the broomweed that affect certain expression of enzymes within the brain. And so there are things within the brain cells, like the neurons, for example, that need to be cleared out. So when animals eat broomweed, those enzymes are blocked, cannot be, the products within the cells cannot be cleared out, and then you get what you call storage diseases. So they stay within the brain cells, it affects the neuron, and before you know it, these neurons start to die off, and then animals start to be wasted away, and then they die very slowly. There are quite a bit of diseases that, there are two main ones. They have these very big names. There's one called mucopolysaccharidosis. There's one called alpha monocytosis. So there are two main diseases that it causes, and these are storage diseases, affects the brain. There's really no treatment for it. The only way you can protect your animals is basically stop them from eating broomweed, because once they're eating it and it gets in the brain, you really can't treat it. You can do symptomatic treatment to, if the animal is having problems here, you can treat that. But to treat the primary effect of broomweed, there's really nothing you can do. Somebody mentioned that you could give vitamins. The vitamins, I spoke about that with the chickens a while ago, that it binds to certain, certain antibiotics would bind to vitamins and make them unavailable, and then chickens or whatever will get paralyzed. If you give vitamins, it helps the integrity of the nerve, but it doesn't last forever. Eventually, you're going to lose those animals. And so the only way you can protect against broomweed is to stop your animals from eating the broomweed. It's quite destructive. You see them shaking a lot. They have head shaking. They walk. They fall over. Eventually, they waste away, and then they die. So that's just the harmful effect of it. It's very, very poisonous. And if you have animals eating it, sometimes you have no problem. They eat it for a long time, and some of them show no problem. But then you have some of them, depending on the enzymatic profile that is going on within the brain, then those ones you'll definitely lose.
Okay. I see Colin Scott 71 says they have broomweed on their farm and he did not know it was harmful. So now you guys know.
It's quite harmful. And there's quite a bit of harmful plants out there. Fern is one of them. We know what fern gully is, all these ferns. Fern is very deadly. People might not know that. It grows everywhere. Animals tend to just bypass it. You'll see it. The other day I was on a farm and I saw a little bit of greenery, and it was all fern, and they're just not touching it because fern is very deadly. It causes bladder cancer. You get red urine. There's a lot of blood in the urine. It damages your red blood cells. Animal waste away, and they die eventually. So it looks harmless. It grows everywhere, but these plants can be quite deadly.
Okay. One group of animals that it is a small ruminant that a lot of times we tend to overlook, and I know that conversation is coming up more and more, is rabbits. So in your full scope of all the animals that you administer advice on, do you give advice on rabbits? And what are some of the challenges that people have with rabbits? Because I know a lot more people are getting into the rabbit industry, so we're trying to touch on that a bit more, just to help that group.
Yes. So we don't classify rabbits in the ruminant group. So what we call them is they're iGoat. They're monogastric, just like a pig, but rabbit is like a small horse. They have the same type of anatomy. So they're iGoat fermenters, which means that they use their cecum a lot. So the food will go there just like the horses, and they pass out something called a secotroph, which they eat, and then that recirculate, and they get their protein from that. Some of the biggest challenges we have with rabbits, people are not feeding them properly. If we don't feed them enough roughage, eventually they become constipated and you lose them. We can't just feed them bag feed alone. They need the greenery, they need the grass, they need the vegetable material. So they have to get the roughage in just like your goats. You can't just feed them concentrate alone. There are quite a number of people who keep rabbits, and they do get sick just like any other animals. When they do get sick, we need to be extra careful when we're actually treating, because 90% of the antibiotics that we have treating animals, they are deadly to your rabbit. If you give it to your rabbit, you're gonna kill them, because as I said, they're hindgut fermenters, just like your ruminants, where they use microorganisms to actually break down the food that they eat. The rabbit does the same thing. Once you start giving all these antibiotics, you kill off the microflora. If you kill the microflora, you kill the animal itself. And so you have to be very careful. There's only a small handful of medication that you can use. You need to know what dose to give. You need to know how to give it. Everything about rabbit is different. You know, it's just a whole different type of animals, very delicate. You know, there are rabbits who have gone into the exam room and they've broken their backs because their hind legs are so strong that, you know, you need to know how to hold them, how to restrain them. You need to know how to medicate them. You know, you need to feed them special diet, because then they have teeth that can overgrow, and then that can, you know, prevent them from feeding properly, and then they could waste away and die. So, you know, we're actually putting together a manual for how to manage rabbits properly. I've been trying to do that for quite some time, but we're trying to get that out so people can know what to do, how to do. And of course, you know, you can always contact us, because we have the knowledge and we are always ready to share that.
I think that manual would, because like I said, I'm seeing more and more people getting into rabbits. I hear about it all the time. And I called it thank you for correcting me. It's not a small ruminant, but I know they fall under the Small Ruminants Association of Jamaica, so I just assumed they were, but we learned something today. All right, good. I did see a question where somebody was asking if you would, if a farm has like dogs or any other pets on there that has issues, would you guys check those too if we asked you to?
Um, you know, it depends on where you are, and you know, I don't think I'd drive out to Westmoreland or St. Elizabeth just to look at a few dogs, because Jamaica has quite a number of small animal vets, and you know, we don't want to be the vets of the country. We want to, you know, keep our you know, our business in a confined space, and we want other vets to actually survive. So I don't think we'd drive out on your farm just to check your dogs when they're small animal vets. And we say small animal vets because, you know, that's predominantly what they do. That's their business, and you find them in every parish. So, but if we are going to your farm and there are dogs on your farm, of course we look at them. That wouldn't be a problem.
Okay, all right, good. Another question here says the challenge about chicken feed contains antibiotics. Does your feed contain antibiotics? Your chicken feed, Nutrimix chicken feed?
We don't include antibiotic. What we do, we put something inside here called anti-coccidiostat, which is not an antibiotic. It does not leave the intestinal tract, because we want baby birds to be protected from coccidiosis, which is probably one of the biggest challenges that you can have with growing broiler birds or even laying hens. So there is anti-coccidiostat, but there is no antibiotic that is present within the feed. No.
All right, so you hear that, Ramsberry? There's no antibiotics in the feed. I can't pronounce what he just said, but it's it's that thing. All right. Guys, go ahead and send your question in. We have a wealth of knowledge here. I see we have a ton of people that joined us. Thank you, guys. Okay, here we go. Outside of change in nutrition and vaccination, what are the other factors that increases Clostridium bacteria in goats? Hey, Marcia.
Outside of
Outside of change in nutrition and vaccination, what are the other factors that increases Clostridium bacteria in goats?
Okay, but so Clostridia, it's widespread. It's everywhere. It's present in the soil. Not just in the soil. It's you find it within the gut of the animal. So it's within the animal. It's a normal microflora. So it's there all the time. It's not doing anything because the animal is healthy. The animal is feeding properly. Apart from changing feed, of course, and vaccination, if you hop the feed too quickly on the animal, so the animal was eating X amount and then you increase that rapidly, then you have what you call most of that feed should be fermented within the rumen. If it bypasses the rumen and gets into the small intestine, then one of the big thing for Clostridia is to start overgrowing, because they get all these undigested feed down there. It starts to digest, or it tries to digest within the small intestine. You get overgrowth of the ones that are already living in the intestine, and then you get Clostridia. You might be wondering, why is my animal infected with Clostridia? And they are in a confined area, but it's present within the animal, and then we can trigger it to overgrow. Other factors, if the animals are stressed, heat stress, cold stress, anything that stresses the animal and reduces their immune system can cause overgrowth of Clostridia. And once it starts to grow and produce these toxins, we call them epsilon toxin. They're very potent. Once they're produced, there are animals who die within minutes to hours. So it doesn't take very long. You could lose an animal in 10 minutes. The animal could take maybe a few hours before they're dead. So it's something that we really need to be mindful of. Goats and sheep, when you vaccinate a human being, maybe you have antibodies that can last for years or for a lifetime. When you vaccinate your goats and sheep, it doesn't last very long, especially when you use the Clostridia vaccine. It doesn't last very long, so we always recommend, and vaccine companies do recommend, that you vaccinate your animals every 6 months to a year. So it's something that needs to be done routinely.
All right, very good. So King Paul says, dirty Liverpool fan. Could you explain how to do a proper vaccine regimen?
So you're talking about goats, okay, and sheep. So if we're doing, let's talk about Clostridia, because that's the main one. If the dam, the mother, was not vaccinated prior, we recommend that you vaccinate the kids. You could start vaccinating them anywhere from about 1-2 weeks old. You can vaccinate them and then vaccinate them again at 3 weeks later. So that's if your dam was not vaccinated prior. If the dam was vaccinated, and we recommend you vaccinate them the last 3 weeks so that they can get that very high titer of antibodies within the colostrum, so you can protect the kids. If that's the case and you vaccinated your dams and the kids are protected with the colostrum, then you can vaccinate those kids when they reach like 2 months, anywhere from 6 weeks to 2 months, and then 6 weeks later, you give them a booster shot. And depending on where you are and the challenges that you're having in that particular area, then you can revaccinate them every 6 months or every 12 months.
Okay, all right, very good.
And of course, the vaccine, it must be done subcutaneously under the skin. It can be very irritating. Sometimes you get these lumps, which are not abscesses basically. They are just reaction from the vaccine, because you have quite a bit of cells coming into that area, to gobble up the vaccine and make antibodies. So you do get these little lumps. So we recommend doing the vaccine just behind the elbow. And then we have a new vaccine, the Clostridium, the Covaxin 8+, which is, not the 5 mils that we usually give, but this one is 2 milliliters, and then it's 2 milliliters per injection site. And so it causes, less reaction, so you do not get that lump that you generally get with the regular 5 mil dose.
Okay. If you do get that lump, though, do you still have to basically treat it like an abscess and get it drained and all that?
It is not an abscess. It's not an abscess. It's something that generally disappears, and that's why we want you to do it just behind the elbow, because as the animal moves and then the elbow is moving, it's kind of rubbing out that area, so it spreads the entire thing out. So so we do not recommend that people actually go and try to drain, because it's not an abscess. It is just a reaction from the vaccine. Okay. Doesn't look good when you do it on the side of the neck. That's not really a vaccine site. It should be done just under the flap behind the elbow. That's probably the best side to do it. Because if you're showing your animals that Denby, for example, and it has this big thing on the neck, which you can't tell, if you say it's not an abscess, because people could think it's caseous lymphadenitis, and if your animals have caseous lymphadenitis, you cannot bring them to a show ring. You cannot let them interact with other animals, so it doesn't look good aesthetically. So it's best to do it behind the elbow.
Even if you're not at a show, it doesn't look.
It doesn't look good.
Normally, it doesn't look good. All right, so there's a question from Facebook that says, "Does there need to be more broom?" Let me see if I read. Is there more to the broomweed problem than meets the eye? For example, could there be different varieties of broomweed? And I can't see the rest of the question. Could there be different varieties of broomweed, or?
I am not a specialist in plants. I do know there's just not one variety. There are different ones, but all of them will do similar will create similar signs. They do cause the same thing once you ingest them, once goats ingest them. So it's and you know, in Jamaica, we know that there are quite a large variety of different plants. If you look at ferns, there are many different species. It would be the same for broomweed. From our experience and the research that I've done, they all do the same thing.
Okay. All right. Very good. So, what is the minimum number of does that you will travel to a farm to inseminate?
Um, and again, it depends on where that farm is. We're located in Kingston. If you're in St. Catherine and you have 3 animals, we will inseminate them. If we're traveling to like St. Anne, for example, we're asking farmers to have at least 6 to 8 animals. It doesn't have to always be your animals. If you have only one animal and you can pool 6 animals together from 6 other areas close to you, then we'll do all those animals one time. So it doesn't mean that you need to own 6 or 8 animals. It could be 8 people with one animal each pool together. We will travel and we'll do that. So for it to be economical, and we're driving across, we're paying toll, we're using gas, we're spending the whole day, preferably at least minimum 6 animals, because it wouldn't be ideal or economically feasible to drive to Mobe, for example, and do 2 animals. It's yeah.
Okay. Very good. So, AI reproduction. Which
Say again?
AI versus natural reproduction. Pros and cons of each.
Okay, AI is, and why was AI instigated in the first place? It was because many reasons. Disease transmission, there's less disease transmission. Doesn't mean that you can't get transmission, with AI, because there are viruses, for example, in horses, that you can get when, in semen, and there are quite a bit of infections that you can get transmitted in semen. So and that's why when they're collecting semen from animals, before those animals are actually used in the AI program, there's a battery of tests that needs to be carried out, which takes a long time before they're past fit to actually go ahead. So disease transmission, parasites, whatever, you carry your buck or your ram over to my place, you mate with my animal, and then you leave something. So that's quite, and there are sexually transmitted diseases in animals that you get from one to the other. So all those things are problems. If there's a superior buck or ram that is available somewhere, it's not feasible for you to travel with your animal to mate with that one or to bring that one to you. The semen is the animal, so you get the semen in. The animal could be in South Africa, you're in Jamaica, you want that particular animal. It's easy to get the semen in, so that's one of the major advantage of doing AI. There are advantages, and of course there are major disadvantages. You need people who have technical skills, very good dexterity, eyesight, to actually carry out the AI. It's not as easy, as it sounds, because if AI were easy, then everybody would be doing it. Not everybody is actually doing it. It's quite a bit technical. So you need to have that expertise to carry out the process. It's a little bit more. It's a little bit more costly if you look at it with the naked eyes, because you're paying X amount as if for the AI, as opposed to having a buck or a ram or a boar just jump the animal. But if you calculate the amount that it will cost you for a given year, to actually keep that one male, then it can be very significant. I haven't calculated the cost from goats or sheep, but I've done the calculation for pigs. And when we calculated it, to keep one pig on your farm for 1 year, the calculation was probably a few years ago, and it was $100,000 for feed, for basic medications like deworming and vaccination. It was $100,000 for 1 year, and you're using that animal only twice in a year, as opposed to if you bought the semen, which would cost you $6,000. So you'd save yourself almost $94,000, if you didn't have the animals. So there's that side. Keeping the males on your farm, it's very costly, because you're feeding them. If they get sick, you have to pay veterinary fees to take care of them. You have to medicate them. So that pushes the question to, should I be doing AI, because it's a lot cheaper to keep just females and no males, and instead of keeping that one additional male, would I just maybe buy another female and then do AI? So it works out to that. So those are the probably main advantages and disadvantages that we see for both of those.
Okay. All right. And then the bucks smell a little bit sometimes. So if you don't want to smell, wait to your. All right. So I have another question from Facebook that says, do you have to be a vet to do AI, or can a web technician conduct the process?
You know, there are vets who will tell you you need to be a vet to do certain things, which is really not true. No, you do not need to be a vet to do AI, you know, because most of the AI technicians that we have right across the country, they're not vets. So we train a number of people, you know, for cattle, for goats, probably all the AI that has been done right across the country for pigs, they are done by owners. You see, when you start talking about large animals as opposed to small animals, not many vets get to do large animals. They don't see large animals. They don't work with large animals. So when you really need to train farmers and technicians to do most of these things. And so most of the AI that you see happening right across the country, they're not vets at all.
All right. Well, that's good to know. I can get trained myself and do my own AI.
If you're trained properly and you have the equipment necessary, you can carry out AI. Just that the instrumentation that you'll need, they're costly,
Yeah.
and it would probably not be feasible for every farmer to actually buy a semen tank, and all their own equipment. But if you look at the States and Europe, farmers do everything for themselves.
That's true.
So it's yeah.
I was just going to follow that up with not to worry. I won't be getting into that, so not to worry. Am I missing? Okay. Any other questions, guys? What booster shot? I'm not sure what that's referred to. Did you talk about booster shots?
Yeah, we did talk about booster shots with vaccine. A booster shot is basically a second vaccine because once you give one vaccine, the amount of antibodies in the blood it goes up, then it starts to come back down. Then you need to give a second or a third shot to actually keep that up, so you can have a longer period of protection. So for Clostridia, we spoke about giving, if you vaccinate your kids at a week old because the dam didn't have any antibodies in the colostrum, you would have to give a booster shot around about 3 weeks later. But if you're doing it the conventional way where the dam was vaccinated, antibodies would have been transmitted in the colostrum, then you'd vaccinate those kids first, maybe at 6 to 8 weeks, and then 6 weeks later, you give a booster shot.
Okay. Tell us about the conception rates and primary protocol used to synchronize estrus.
So conception rate, the conception rate that we are getting is in line with what we see, out there in the literature. If you look at some of those material that has been published recently, conception rate, if you're doing, for example, if you're doing AI and you leave the semen in the vagina, conception rate ranges anywhere from 15% to 30%, which means if you're doing 10 animals, 1 to 3 animals could get pregnant. If you're leaving the semen in the cervix, conception rate is anywhere from about 35 to 50%, which is like, you could get 3 or 4 animals out of every 10. If you leave the semen in the uterus, and that's where we leave it, conception rate is from 50% to 85%. That's a publishable conception rate, which means if you have done 10 animals, it is possible for you to get 5 pregnant or 8 pregnant, and that is normal. That is probably the highest number that we've seen. With our figures, we've had good days, we've had bad days. We've had conception rate of less than 50% sometimes, but we've had conception rate in the 90%. There's even one farm that we bred and we had 100% conception rate. And you'd be wondering, did you breed one animal? No, we actually, I think on that particular farm we bred 11 animals and we had all 11 pregnant. I think it was the last set of animals that we bred, it was probably, I think we did 10 and we got 9 pregnant, so that would have been 90%. So, our conception rate is within the normal limits. We've had very good success and we've done quite a number of animals all over the place. So when we tally and look at the numbers, it's really a good number, I think.
Very good.
What was the other part of the question?
Oh,
the protocols that we use. Okay. So there are quite a number of protocols out there, and again, we like to look at science because I do believe in science, as I'm a scientist. We want to use the protocol that we think is best. But there's no best protocol if you're not doing the right thing. And, the conditions under which, the animals are kept, you need to look at that, because if everything else on my side is good and everything on your side is bad, the best publishable protocol will not work on your farm. So we need to be careful when we're talking about, using the best protocol, and we didn't get the required conception rate. So we use a protocol that lasts, we use a shorter version of the one that we usually use. There are 3 visits that we make to your farm. So we come on day 1, we ensure that the animal is not pregnant. So we'll do ultrasound. When we're happy with the condition of the animal, then, we use a progesterone implant that we inject, that we implant. And then, there are 2 additional drugs that we would administer once we've pulled that progesterone implant, and then we would have bred your animals within 48 hours later. So that is the protocol that we use. And why we do that is, we're actually telling the animal when we want them to actually ovulate. So we have to ensure that we calculate the time correctly, because if you miss the time and you put the semen in and then the egg would have been there waiting for the semen, then nothing will work, because the semen takes time to travel from the uterus up to the oviduct where they're going to meet the eggs. And the semen has to go through a process. So it has to travel up the track, and it goes through that final process called capacitation. So, if you take the semen out and put it to the egg, nothing happens. It needs to get into the reproductive tract. There are enzymes that are secreted by the female that takes the seed. It's a chemical process that, it's called capacitation. And once it gets there, it needs to wait for the eggs. And then once the eggs come down and meet the semen, that's where you get your fertilization. So you need to know what you're doing. It's a time. What we use is something called a fixed time AI. So, you time the animal, and you need to time them for almost 2 weeks back. So you need to know when the egg is going to be released, so you know exactly when to put the semen in. So you really have to have a very good idea about animal physiology and reproduction to actually get it right. Because if you miss it by a few hours, then nothing will happen.
So what if you have a scenario where you selected a goat, you got the AI process done, and then somehow one of your bucks got to that goat, and yeah, is that
Yeah.
So that scenario?
So we always recommend that once your animals are synchronized for AI, they're gonna come and eat, and once they come and eat, the bucks will go crazy. We always say put your animals in a locked up area, but then you can get, once you breed the animal, it doesn't mean that particular animal is not on eat anymore. So the males are going to still be trying to get over to that animal. If it happens right away, like within a few minutes later, then we could run into a problem, because we're putting a small dose of semen within the reproductive tract. If the buck or the ram gets to that animal, the ejaculate is going to be billions of semen. So we could run into a problem where if the animal gets pregnant, we don't know whether it's AI or the male. So that is a problem. If it happens later, days later, maybe I wouldn't be so concerned, because the female would already not be producing estrogen, and if there's no estrogen, it means that the plug within the cervix would have been formed and closed off, and then the female wouldn't allow the male to actually jump on her. So maybe that wouldn't be much of a problem.
Okay. So we have 1 minute and 35 seconds remaining. So let's go ahead and end the session now and come back in, because I do have a couple more questions that I've seen come through for you guys. All right, so guys, we're going to end the session and come right back in, okay?